Hello everyone, this is the Mental Health for Life channel. Depression is a disease that drains the energy to live. It causes mental symptoms such as feeling down, not being able to have fun, and loss of energy. At the same time, the brain ceases to function normally. Since the brain and all organs are closely connected by autonomic nerves and hormones, the body is also affected in various ways. Depression is often thought of as a mental illness, but many physical symptoms also appear. In fact, many people who go to internal medicine or orthopedics for gastrointestinal disorders or pain are referred to psychiatry, where they are diagnosed with depression after tests fail to reveal any abnormalities. If physical symptoms persist for a long time and no abnormality is found on examination, it is possible that you may be suffering from depression. In this video, we will introduce 12 physical symptoms seen in depression. 1. Insomnia. Sleep disorder is seen in most depressed people. There are two types of sleep disorders: insomnia, which makes it difficult to sleep, and hypersomnia, in which no matter how much sleep a person gets, he or she does not feel rested. Insomnia is especially common in depression. It is difficult to fall asleep, and even if you do, you cannot get a good night's sleep because you keep dreaming and feel tired. You wake up early in the morning and do not want to get out of bed. Someone with insomnia might go to a physician and receive only sleeping pills. If they are able to get enough sleep but still don't feel well during the day, they may be suffering from depression. In such cases, we recommend that you consult with your doctor or visit a psychiatrist. 2. Lack of appetite, weight loss, diarrhea, or constipation. Depression may cause loss of appetite and weight loss because of the negative effects on gastrointestinal tract movement through the autonomic nervous system. The patient visits an internal specialist to check for gastric cancer, but is diagnosed only with mild gastritis, and no major abnormality is found. Food in general may not taste good, and the taste may even feel different. In addition, a patient may visit a physician for nausea and be diagnosed with reflux esophagitis, in which gastric juice flows back into the esophagus. But depression may be hiding behind this as well. In addition, depression can cause repeated diarrhea and constipation, and some people rush to get tests to see if they have colorectal cancer. Thus, gastrointestinal disorders are deeply related to depression. 3. Heavy head and headache. A feeling of heaviness in the head and headache are very common in depression. In particular, tension headaches previously diagnosed by a physician may have depression behind them. Stubborn headaches that do not get better with headache medication may get better with depression medication. 4. Dizziness. One of the most common types of vertigo that occurs with depression is floating vertigo, which is a sudden feeling of fluttering around on one's feet. It is similar to the feeling of the ground shaking during an earthquake. When it occurs while walking, it is difficult to walk straight. ENTs specialize in treating vertigo, but if there is nothing abnormal on examination, depression or stress may be the cause. 5. Chest tightness and breathlessness. Symptoms such as tightness in the chest, palpitations, and breathlessness may bring to mind a heart condition, such as angina pectoris. However, if an EKG or other tests are performed at a physician's office and there are no abnormalities, it may be a physical symptom of depression. This is especially the case when the patient wakes up early in the morning with chest pain and palpitations. This is not a symptom of a heart or lung problem, but rather a symptom of dysautonomia due to depression, which causes the brain to send the wrong signals to the organs. The same is true for chronic coughing, hyperventilating, sighing, or having something in the chest that is bothering you. 6. Frequent urination and night sweats. Chest symptoms are not the only symptoms that can result from autonomic nervous system dysfunction. The autonomic nervous system is connected to all the organs in the body, so a variety of symptoms can appear. Frequent urination, residual urine, sweating, and night sweats are common. Another symptom is dry mouth due to decreased saliva production. 7. Irregular menstruation or impotence. Depression can also manifest itself as sexual problems. This is because the secretion of male and female hormones decreases, resulting in symptoms similar to menopause. Some women may experience irregular menstruation or stop menstruating, and some men may become impotent. Interest in the opposite sex will also disappear. 8. Pain. Depression makes the part of the brain that senses pain more sensitive, so pain is felt many times more intensely than usual. If you have chronic headaches, facial neuralgia, frozen shoulders, or back pain, and medical or orthopedic surgery does not find anything wrong, or if pain medications are ineffective, you may be suffering from depression. 9. Numbness in hands and feet. Like pain, unexplained numbness in the limbs can be a sign of depression. There is no problem moving them, but they feel uncomfortable, as if there is a weak electric tingling. 10. Lassitude or lethargy. Continued lethargy after sleep or rest, and stiffness in the neck and shoulders are common early symptoms of depression. Even after a good night's rest, you may still feel as tired the next morning as you did when you got home from work. 11. Symptoms like catching a cold. People with depression generally have a high body temperature and may suffer from a low-grade fever that is slightly above 98.6 degrees Fahrenheit. Fever is usually caused by an inflammatory reaction in the body due to an invasion of bacteria or a virus, which results in the production of a thermogenic substance. In the case of depression, however, the brain sets the body temperature higher in response to stress, even though there is no inflammation in the body. A persistent low-grade fever makes the body sluggish and may make it difficult to stay awake. At the same time, some people develop a cough due to autonomic nervous system dysfunction, so in some cases, it is difficult to distinguish the condition from a lingering cold. 12. Decreased immunity. Depression also lowers the body's resistance. Immunity to bacteria and viruses is also reduced, making the body more susceptible to colds and cystitis. Shingles, a viral disease that causes a rash and pain in the chest and other parts of the body, is also common during depression. These are some of the physical symptoms seen in depression. According to a survey, many people with depression visit an internal specialist or orthopedist for these physical symptoms and are then referred to a psychiatrist. Surprisingly few people visit a psychiatrist from the beginning because they are often more distressed by physical symptoms than by mental symptoms. Physical symptoms that do not improve with internal medicine or orthopedics will always improve as treatment for depression progresses. Depression is also a physical illness. This was the Mental Health for Life channel. If you like this video, please give it a thumbs up and subscribe to our channel.